Well, welcome everybody to our special launch webinar. We're sharing tonight a new mental health strategy resource. And we hope this resource is going to enable churches to maximize their impact, supporting mental health in the neighborhood. That's in our most local patch footprint, but also citywide and even bigger than that, countywide. So it's great to have you with us tonight. And we'd love you to just add on to your name, the place or town or city that you're based in. That's really lovely to see where you're from. And just to let you know, we are going to be recording this session tonight. It's fantastic to record these conversations with our guest presenters so that we can refer people to them at other times. So I'm Mark Cowling. I'm part of a small core team that supports over 150 church unity movements across the UK with Gather movements. And it's lovely to be with you this evening. We're really excited about many doors opening for church unity movements in our country at the moment to be involved with the transformation of their places. And we think about transformation socially, culturally, and spiritually. And we're seeing some really incredible progress the church is making in supporting mental health and well-being. We'll talk about that tonight. Gather movement strongly believes that the church is called to a work of unity as it engages in mission in our places. And we really believe that we're supporting a new paradigm of church leadership as we work together in linking multiple churches, delivering multiple services in the community, and also collaborating with our civic and health sectors and other organizations. And we'll be sharing examples of this later on this evening. So thank you for joining us, and we'll get going with our webinar. I want to welcome two incredible speakers who are going to be joining us tonight from organizations that are doing incredible things in mental health through the local church. So Clary and Stacey, do you want to just introduce yourselves?
So hi, I'm Clary. I'm the Bristol Regional Lead for Kintsugi Hope. Kintsugi Hope is a UK charity which supports churches and Christian organisations to run mental health wellbeing groups.
Thanks, Clary. Stacey?
Hi, I'm Stacey. I'm from Lincoln. I'm the Nightlight Cafe manager. I'll be telling you more about the Nightlight Cafes later. And I work for Axe Trust and I'm part of Bridge Church in Lincoln.
Fantastic. Thanks, Stacey. So we're going to go through a new resource that Gather and Kintsugi Hope have published recently. If you look in the chat, you will see a comment there that I dropped in at 1858, a Dropbox link, which will allow you to download the resource. But we're also going to have it on the screen as well at points in the evening. Essentially, we're going to go through this resource. We're going to look at what the needs are for mental health support and a strategy. And we're then going to get into some of the things that churches can do. We'll take you through that. We'll hopefully have time for some questions and answers and some breakout groups, but I'll keep an eye on the clock for that. Without further ado, Clary, let me hand over to you and ask you the question, why do you think the church needs a mental health strategy?
So I'm going to start with answering that from a bit of research. So along with Theos, Kintsugi Hope carried out some research looking into attitudes into mental health in the UK church in 2021. And we found that 56% of our interviewees said that they had experienced mental health issues. So the astute of you will notice that is actually higher than in the local population, in the national population, which might be because people who are interested in mental health are more likely to answer the questionnaire. But I think it's also very realistic that actually people who are struggling are attracted to Jesus and attracted to church, and it shouldn't be a great surprise that we're going to find people in our churches who have experienced issues. But the really one of the really sad things that we discovered from this research was that of those people, only 35% said that they felt their church had supported them. And so that's obviously something that we desperately want to change, and to know that so many people in our churches are feeling unsupported in their issues is a massive deal really for us. But I also want to share with you something that was really encouraging that came out of the research, and that was that the vast majority of UK Christians felt that the church had a role to play in mental health. And that's not just within their own congregations, but actually also within their communities and within the national population. And that is really encouraging, that that is a need that a lot of people recognise and a lot of people feel the church can speak into and has got something to do in that space.
Thanks, Clary. We know that mental health is a massive need in our communities, and civic leaders, when we speak to civic leaders at Gather, we hear them stating mental health as one of their top 3 priorities in our communities, along with food security and supporting families. Churches, we know, can be transforming and are transforming places of support and healing for people. But we also know that our society is challenged to think in a new scale, in terms that can move towards models that are going to be more long-term and enable people in our communities to live life in greater fullness. And actually, when we look at the figures for mental health, whether it be suicide figures, which kill more people than anything else for men under 50 and women under 40, we realise, and we look at the rates for anxiety and depression and so on, self-harming. The figures really are scary. And as my colleague Ian, who's here tonight, reminds us, we need to hold the numbers and the narratives and networking together in our minds. Gather believes that we need to really survey our communities to understand what's happening in our communities. Communities vary, and depending on which part of them we're in or which city we're in, and we need to survey them to understand where we're starting from and what the needs are. And we believe the narratives are really important to hear so that we understand what the needs are in our community, alongside what's going well, what the positive interventions are that we're doing. And Kintsugi Hope and Stacey's project in Lincoln are 2 really great examples of that. But it's also the networking. So it's the numbers, the narratives, and the networking. Churches have to, if we're serious about mental health, engage with networking. We have to see this as being across a range of models, across a range of structures of mental health provision, involving all the sectors. And we believe that there's no one organization that can just solve this mental health crisis in our communities. It has to be done as a cross-sector collaboration, and that's what we want to discuss tonight. It would be lovely at this point just to hear what people experiences of mental health and ministry in church. I've got a message here from Steve saying that we've got someone, Cassius, I think, from an organization called At a Loss, who do work on bereavement. So Cassius, do you want to just tell us about, just in 30 seconds, your experience with mental health and church?
Hi, thanks for the opportunity, Mark. I hope you can hear me okay. I'm here with my colleague, Reverend Canon Yvonne Richmond Tulloch. I think our experience through the work with At a Loss, which is the national UK bereavement signposting website, is really just the experience that we see our work has been preventative in this area around mental health, and recognize that particularly coming out of the pandemic, with a huge emphasis rightly on mental health support, that we also have a huge amount to contribute through the area of bereavement support, and recognizing that if we are able to put things in place at an early stage for people to process grief, that it will help to alleviate potential further problems later on down the line in relation to mental health. So I'm really pleased. I hope that gives you a snapshot. Love and Hope, the organization that I've put in my title, is the Christian arm, if you like, of the national charity At a Loss. So I hope that gives you enough context.
Oh, it's really good to meet you and to hear about your work. Yvonne, welcome as well to you, but I'll go on to Esther. Esther, do you want to introduce yourself?
Sure. Good evening, everyone. I'm Esther, and I work for the Good Faith Partnership, but I'm part of the Churchworks Secretariat. And in Churchworks, we have a commission made up of leaders of the biggest denominations in the UK, and we're exploring how churches can work together with the government and local authorities to support vulnerable people in our communities. And we had a wellbeing conference almost a month ago now, which quite a few of you were at with us, which was great. And our kind of experience and thinking behind setting up that conference, and from what we've heard people on the day, is that lots of church leaders really care about mental health, but they're not quite sure where to start, and they're not quite sure what to do next. And so lots of the organisations that were with us at the event have some really great opportunities for things that churches can do, and this mental health strategy is really exciting as well in terms of offering churches some guidance and support in that.
Brilliant, Esther. Good to have you with us. I've just dropped in the Dropbox link for the mental health resource. If anybody has not got that, who's recently joined the call, you can download it from there. We're going to be looking at that tonight. Rachel Bates-Stretford, do you want to just introduce yourself? Great to have you with us. Can't hear you, you're on mute.
Sorry, yeah, no, it's all right. I was just messing with the link while you were talking. Yeah, so I'm, like I say, Stretford and Urmston in Manchester. We don't really do anything at the moment. I think the reason I'm here is because I'm currently looking at the whole idea of our duty of care as a church and what that involves, and mental health comes into that. So we do some things which maybe help people with isolation, that type of thing, but it's really just discovering what other people are doing and what can we start to do.
Brilliant, thank you. Well, it's great to have you with us. Let's go on to Stuart Hutchison. Do you want to just introduce yourself and involvement with mental health, if any?
Yeah, I was doing the same as the previous person. I'm a recently retired GP from Tewkesbury and currently running our first Kintsugi Hope group at church, and that's going very well. And I was at the meeting in Westminster Chapel a month ago representing GP chaplaincy.
That's right, I remember you, Stuart. Yeah.
Yes, we met, yeah. And so, yeah, we're looking to get chaplains into general practices in as many parts of the country as we can.
Lovely, welcome. Ian, great to have you. Just want to introduce yourself?
Yeah, hi there, Mark. Hi, everyone. Ian Rutherford from Methodist Central Hall in Manchester. My colleague Karen here today. We are seeing a lot of mental health incidents within the city centre of Manchester, both within our own foyer and cafe and in the sort of surrounding streets. It just seems to be increasing all the more. So we know what the great need is. I'm particularly involved in looking at social prescribing into some of our churches. And you may have seen some of the webinars that we've done in relation to that, particularly green social prescribing, but also looking at some work that we've done in Chapel in the Fields in Greater Manchester, which is referenced within the strategy report. So it's great to see us all here. This spectrum of mental health is such a massive thing. And as Mark was saying earlier, we just need to be sure of looking at the sort of narratives that are all different and special circumstances that need to be dealt with, but also how we can be together in networks to achieve some change in that respect. So great to be here.
Thanks, Ian. Cheryl, George, welcome. You're on mute.
Thank you.
Okay.
I am Cheryl from Bliss Community Church in West London. And personally, I'm a parent who has navigated really tough mental health struggle with one of my children, and sort of first-hand knowledge of how difficult it is to get help and to communicate and to give them appropriate help. Yeah, so I'm really interested in, you know, have found several obstacles in the way that the system works, and a lot of frustration from everybody involved. So yeah, that's one part. And then I'm also very involved in a Christian charity called the Christian Healing Mission, who uses a model of prayer, which is encounter prayer, which seems to be really, really helpful, particularly with mental health, and helping come alongside people and connect them in prayer personally to Jesus rather than pray at them or for them, which is also valid, but it just is a really good model in walking alongside people through mental health and other healing issues.
Amazing, Cheryl. Thank you so much for sharing that. That's great to have you with us.
Thank you.
John, do you want to just mention John Tomlinson? Do you just want to say hi and any connection you have with mental health?
Hi, yeah, I'm John. I'm from a church in Bolton. I'm a retired doctor as well. We're just in the process of setting up our first Kintsugi Hope course. And I've come on the course because I want to find out about, you know, what resources there are available to signpost people to. So I'm here to listen really rather than to contribute, I think.
Great. Fellow Boltonian, so lovely to have you, John. Nice to meet you. Helen Clark, welcome. Do you want to introduce yourself?
Yeah, I'm Helen from a church in Ruskington near Sleaford. And for me, it's really just a fact-finding mission tonight. We're just about to start a community hub from our church. And Fiona, who's also on the call tonight, she's sort of heading it up. And so I'm just learning sort of what's available, and yeah, just a fact-finding mission for me.
Thank you. That's really great to have you. Thanks, Helen. Karen, I think Ian introduced you, is that right, from Manchester Central Hall? Welcome.
As Ian said, we have seen this massive increase of problems with people with mental health problems. But from a personal point of view, like Cheryl, I am also a parent of somebody who had significant mental health problems. Unfortunately, at the same time, I had my own significant mental health problems. And when I started to, during lockdown, when we went back to church, and I started to say to people, they started to talk about the people out there who had mental health problems. And I was like, do you know how medicated I am right now? And this was somebody who's known me all my life. And they went, oh, anxiety, depression, seeking ADHD and autism assessments, this, that, and the other. That's just me. My son's got other things. And they went, no, didn't know what to do. And so from my point of view, if I can help them understand where I've been, where I'm coming from, what it's really like to sit one side of a bedroom door thinking, I don't know if my child is about to take his life, and having to hold it together and not do something stupid myself. I need my church, who've known me for 40 years, to understand that, because if they can't learn it from me, they can't learn it from a stranger.
Yeah, brilliant.
So it's the two sides of it that I'm really interested in. Yeah,
that's amazing. Karen, thank you so much. Fiona, good to see you from Kintsugi. Do you want to just quickly say hi?
That's really powerful, isn't it? Hi guys, I'm a Kintsugi Hope ambassador. I was with Mark at the Gather Movement in Sheffield last week. I'm a Sleaford community connector, so when Helen was talking about the hub in Ruskington, Sleaford, we're getting together, aren't we, Helen, and hoping to create something for people in the community to help with mental health. It's in partnership with the NHS and the church and obviously the community. So we're looking forward to getting cracking with that.
Thanks, Fiona. And Steve, my colleague from Gather, do you want to just introduce yourself?
Yeah, I'm doing quite a lot of work with the West Midlands Mayor. We're working across the faiths, and we've had a project on mental health for quite some time. I think what we've found is the symptoms, the issues are common, what have you got, what faith you've got or no faith. The solutions may well be different. And the challenge for the church, I think, is how do we create the support networks that actually the whole community needs so strongly? But also, how do we address the issues within our own communities if there's a lot of shame, there's a lot of secrecy, and often there isn't the support in place? So how do we create a seed change in church? The other thing that I'm doing is working with some of the integrated care boards, as people may well be aware. They've got a duty to look at community-based care, and they're really interested in what provision the church can create. And I think one of the challenges for us in the coming year is how do we access some of that funding with effective proposals and schemes.
Brilliant. Thanks, Steve. Great to have you with us. Well, thanks, everybody. It's been lovely to just hear about the expertise and the passion, from everybody on this webinar. I'm going to hand back to Clary now for her to just share a bit more about the fact that we all have mental health needs and help us to think a little bit about that and perhaps from there, where we go from that. Clary.
Thanks, Mark. I'm just going to share a little diagram here. So this is the mental health continuum. Many of you may have seen this before. This is from Mental Health First Aid. But we find it's a really helpful framework for just thinking about our language and how we're talking and understanding mental health. And someone earlier mentioned about there being a whole spectrum, and that's really what we want to kind of get across. So just to really briefly explain this to you, the first axis, the up-down axis, is our mental health. Now, we all have mental health, just like we all have physical health. Sometimes our mental health is really great. Sometimes we are thriving, we are participating in community, we are managing our relationships, and things are going really well, and we're right at the top of this scale. There's going to be other times in life where our mental health is lower, and actually we're really struggling, and life is really hard for one reason or another. And all of us go up and down this scale all the time. Some of us might flip very quickly from day to day or week to week. Sometimes we might have seasons of life where we're higher or seasons of life where we're lower. But everybody has mental health, and everyone's somewhere on that up-down line. Then we have the left to right axis. And on the left-hand side, I think right-hand side maybe as you're looking at it, we have no diagnosis. And that's where somebody hasn't got any diagnosable mental illness. And actually that's 3/4 of the people most of the time aren't diagnosed with mental illness. But then as you move along the line, you'll move into things like depression and anxiety, the more common mental health issues, through to things like perhaps obsessive compulsive disorder or PTSD, the more severe mental health issues, or major depression, right into the most severe mental health issues, right at the end of the line, things like psychosis or bipolar disorder, which might be lifelong impacting mental diagnoses, mental illnesses. And again, people will move on the scale. People might move in and out of times of depression or anxiety. So it's not a fixed scale. And again, we're all along that line somewhere. And what I like most about this mental health continuum is it gives us a lot of hope, because even when you're right at the most severe end with your mental illness, you can still improve your mental health. You can still have times in life where perhaps your medication's stable or your therapy's really working, or you've got good relationships, you're inputting into your community or your church, you're finding meaningful activity, and actually things are kind of going okay. And that is really, really hopeful. And of course, then we'll have the place where we all want to be, which is when we don't have a mental illness and our mental health is really good. And that's not to say we can't do things in that point to keep our mental health well. Just like you can be really physically healthy and still go to the gym because you want to keep your physical health well. We can all look after our mental health even when we're well. Then we have the space where actually we're not in a diagnosable mental illness, but we're struggling. And that's a really common place for a lot of us to be. I think a lot of us went there over COVID, a lot of us go there a lot of the time, and lots of different things can move us into this space. Things like loss and grief can absolutely move us into this space where we're struggling, although you wouldn't say we're diagnosably mentally ill. And then, of course, we've got the space, and we really don't want to forget the people who are in the space where actually they have got a mental illness, which is really impacting their life, and they are really struggling with it. And actually people in this space might need a lot of very visible and active support whilst they're in that place as well. And I hope that as we talk more today, we're going to be thinking about actually how do we, the church gathered and churches together, look after people at all the spaces, both up and down and left to right along this mental health continuum.
Thanks. Are you handing back to me, or are you carrying on?
Shall I carry on into then what do we do? Where do we go?
Well, I guess just to punctuate that, we now want to look at 5 things churches can do that address the continuum of mental health needs. And we're going to start with one thing now that, if you like, we all need to do, no matter what age we are, what our mental health is like, is something that we can all benefit from. So that's mental health friendly churches. And let me hand back to you, Clary, to explain how Kintsugi Hope can help us with this.
Thanks. So mental health friendly church came out of a conversation where someone asked the question, what if our churches are not safe and supportive spaces for people who are struggling with mental health issues? And I think the reality, and especially the historical reality, is that our churches are not always that safe and supportive space. And that's for a number of reasons. One of them is that we discovered that 91% of our church leaders across denominations have had no formal training in mental health. And again, that might not be surprising if you think about the decades during which they did their training. Thankfully, things are changing now. But that's a reality for a lot of our leaders, is they're faced with situations they're not trained to work into. And also we found that most churches, over half of churches, rarely or never talk or preach about mental health. And so there's a real kind of vacuum there for knowledge and awareness and training. So we've developed some training called Mental Health Friendly Church Training, and its aims are to really elevate our understanding as Christians. Do we have a good, sound, biblical theology of mental health? Are we confident in what our position is on mental health, and are we able to say that confidently? Secondly, we want to start eradicating some of the stigma that still exists within our communities around mental health, actually opening up and talking about this and having conversations so that our churches are not stigmatizing places. And then thirdly, a real encouragement that we can all respond with compassion and a gentle presence. And we use gentle presence to mean being with people, coming alongside people in the way that Jesus did. It's not about fixing people, it's not about solving people, but it's about walking with people through the ups, through the downs, in a really gentle way. And actually our churches have an amazing thing to offer to everybody within our congregations, in that we have the presence of Jesus with us and we have the Holy Spirit with us, and we can offer that love and that compassion and that support and that gentle presence to everybody in our churches and in our communities. And that's a real blessing and something really special. So we've developed at Kintsugi Hope, we've developed some special training that looks at these areas in order to kind of equip, church leaders, but actually also the lay leaders in the church, so the small group leaders, the pastoral care team, any of the youth group leaders, anybody who's got any sort of caring responsibility. And if that's something which you think your church would be really interested in, then please do go to our Kintsugi Hope website. I'll stick the link in the chat in a sec, and get in touch with us. And we may be coming to a city near you already, or we might want to work out with you when we can come to you and provide this training, if that's something that you feel would be really useful and helpful. Pass back to you, Mark.
Back to me. Thanks, Clary. That's helpful. I'm just sharing the screen now of one of the pages from the mental health resource that Gather and Kintsugi have published. You can see there the 5 areas that we're going to go through tonight. Clary has just been explaining about the mental health friendly church training, which I strongly recommend that you get your church to do. And make sure that you tell all your churches about it in your local area, so that they can come along and make the most of those opportunities. The second thing we've got here is getting active. So there's a great statement from the Chief Medical Officer that says, if physical activity were a drug, we would refer to it as a miracle cure due to the great many illnesses it can prevent and help treat. And we mustn't forget about the benefits of physical activity for our mental health and well-being. And yeah, we're going to go into social prescribing as a second thing, but clearly getting active does also have a social aspect to it as well. But getting active, we really mean is being physically active so that your heart rate is raised for at least 20 minutes. And we know that there are significant mental health benefits if you can do that. And churches run lots of groups that do this. I've been part of running groups at churches, football groups, and I'm sure you're familiar with walking groups that churches do, and perhaps dancing, aerobic activity groups. And I've also come across bike riding groups now that have fancy apps for finding out where the local ride is to go riding with others. So all sorts of things that churches are already doing that will be great to create a calendar for, so that we know where we can find them in our area. Because it's not just the physical activity with a church, you're also being welcomed into a family, into a community, where there's all sorts of other opportunities to connect. So yeah, it's a great thing that we do, and we need to, if we can, just create a calendar for our town or our place of where these things are happening, when, how to get in touch with them, so that people across our churches, but also in our community, can connect with us. I have also, you'll see in our resource, we talk about Love Running, because it's a project that churches have done around the country. It was started in Bristol, where Clary is, called Love Running, and it advertised itself as getting fit, get friends, and change the world. And it was a number of churches in Bristol that got together to go running between, I think, January and May, when the Bristol 10K happens. And for people who've perhaps never run before, all abilities, getting people together, and also raising money to do the sponsored 10K. And in Bristol, they've raised over £800,000 for charity through that. And it's been a major project of evangelism, actually, as well as supporting mental health. We've repeated it in Manchester with great success and raised lots of money. And people have actually, that I know, who started running for the first time in many years, 10 years ago, are now still running, and say that it's because of the Love Running project, or campaign and activity that started off. The other thing that's a great joy is when you see young children participating in junior fun runs, and you ask them at the end, did they have a good time? And I've got some film recordings that record children say, yes, it was fantastic, I'm definitely doing it again next year. And having been a minister in deprived areas, it's just a thrill to give access to some children to a community fun run event like that in an organized way. And again, something to partner perhaps with schools in, to get children exposed to the idea of physical activity in a way that's fun and enjoyable. Just lastly on that, I want to mention that Sport England are an organisation that provide funding, particularly where there are barriers to physical activity for families and people of all ages, especially in deprived areas. And as a church, we access some of that funding in Bolton to do fun workshops that were all about empowering people to overcome some of those barriers for themselves, but also some of the barriers for their communities. For example, if there's a bus that doesn't go to the leisure centre or something like that. So there are ways that as churches we can engage in more structural and systemic ways with thinking about barriers to activity in our community and physical activity. So that takes us, I think, nicely on to social prescribing. So Carrie, I'll hand back to you. You're on mute, Carrie. Clary.
Thank you. I'm just going to quickly share my screen again. So this very quickly, Mark's mentioned about the fact that churches often run activities with people in places, and this is really what joined up connected communities look like. And when it comes to accessing this, when we're well, when we're healthy, then we often manage to access these activities independently. We don't need any support. We just go along to them. Sometimes we need a bit of support. Sometimes we wait for our neighbour to say, oh, do you want to come with me to toddler group? And we go with someone, and that would move us into this kind of green band here where we have community support. We go with our friends, we go with our neighbours to go and access an activity. But the reality is that as people's mental health starts to deteriorate, or as people experience a lot of isolation and loneliness, actually they find accessing these activities which the church is running really difficult, or activities which anyone is running really difficult. And that moves us into the area of social prescribing. So with social prescribing, what we're looking at is where people have specialist support that then will help them to link into the activities and the groups which are already running. And so often at the moment, the social prescribers are social prescribing link workers. They're often employed by groups of GP surgeries. They accept referrals from GPs, but also social care and other local agencies. And now I guess the real challenge for us as churches is how are we making our groups and our activities, which are already running, available to those people who are particularly in need of those activities. And one way we can do that is by linking up with the social prescribers in our local areas to let them know these are the things we're doing, these are the activities we already have running. We would love you to invite people along or direct people to or help people get into the groups are already doing. My experience of doing this in Bristol and of talking to people over the country is actually that is it works quite differently in different areas across the country, how you actually make those links. But one thing Kintsugi Hope and Gather are doing is creating a resource which is going to help you and your churches to work out how do I link in with my local GPs, how do I link in with my local social prescribers, so that the things we're doing in our churches are available and are accessible to people who might need that bit more support and that bit more help to come along and take part in them. How's that, Mark? Anything else I need to say on that?
No, that's great, Clary. Thank you very much. That takes us nicely on then to talk more about the Kintsugi wellbeing groups. So do you want to carry on and tell us about those?
Yeah, you can't stop me talking about Kintsugi Hope wellbeing groups. So Kintsugi Hope wellbeing groups are I guess I'm going all NHS speak then, a targeted intervention, I was going to say. They're a peer facilitated support group which is run by the church or by a Christian organisation in order to help people with their mental health in a really gentle, really supportive way. So they're not therapy, they're not about fixing people, but they are about creating honest conversations, real community, a sense of belonging. And our aims are that people would learn some self-help tools, that they would improving their own self-esteem and their own confidence, that they would be signposted where they need to be signposted. And actually my experience of running Kintsugi Hope wellbeing groups is I don't think I've run one yet where I haven't said to somebody at some point, do you know, you've talked about this for maybe the very first time, and I wonder if going to your GP might be really helpful for you at this point. But also that people experience the reality of God's love for them. So they're not explicitly evangelistic, but what they do is they create an environment in which people feel loved and they feel accepted and they feel belonging, and that's really powerful. So I just wanted to share with you a little promo video from Kintsugi Hope about the wellbeing groups. Like I said, I could talk about them for hours. So after the video, I'll probably stop talking about them. But maybe if there's time in Q&A, or maybe if people are particularly interested, I'd be really happy to say more about how they work and how you can get involved in running them. So I will just share a little video with you now.
Life can feel like a game of Tetris. No matter what you do, sometimes the blocks don't line up. days spent trying to keep all the plates spinning, but sometimes it's just one plate too many. Or perhaps you're giving out of an empty cup. Some of us invest in our physical well-being. Why not invest in your mental and emotional well-being? We can all feel broken, but we can all discover treasure in life scars. Join a Kintsugi Hope wellbeing group.
So that was just a little promo video. Yeah, just to be really clear about kind of where we're looking at, the groups really are aimed at people who, like I said, might be struggling with their mental health, might be finding life tough for whatever reason. Not necessarily they've got a diagnosed mental illness, but life is tough and they're struggling and they need a bit of love and a bit of extra support and have some ideas on what they can do about it in a really helpful and productive way. We've also had some really lovely stories of people coming on it who do have more significant mental health illnesses, but at a really stable place in their life, and they're a place where they can take on ideas and have useful conversations. It isn't a group that's aimed at people who are struggling with significant mental health illnesses or are in crisis at the moment. It's much more kind of that gentle support for people who just might be finding life tough right now, and it's really, really good at starting to open up some of those conversations around mental illness and around mental health and around emotional well-being. So we've got them running. I think we've got over 400 partner churches and organisations now across the UK running Kintsugi Hope wellbeing groups, which is really exciting for a relatively new charity. But we're having wonderful, wonderful stories, loads of great feedback from people who are attending them all the time, which is just amazing. So yeah, they're Kintsugi Hope wellbeing groups.
Thanks, Clary. And do you just want to tell us about, they're coming about 12 sessions, don't they? I know you do a youth version. The normal adults version comes in about 12 sessions. Can you remind me the sessions that you cover in that?
Yeah, so there's 12 sessions in the normal adult version, like you said. So we start with honesty, then we look at things like anxiety, depression, shame, anger, all the way through to things like self-compassion or self-acceptance, I should say, healthy relationships, resilience. So it's 12 different topics. We have a specific youth version and a specific student version, which are shorter in order to fit into the school and the student terms. But we've also had loads of people adapt groups to run in lots and lots of different contexts. So we've had men's groups running in prisons, we've had mums and toddlers groups running with it. I was talking today with someone who's planning on running it with some people in the sex work industry. We've had it running in hairdressers, we've had it running in coffee shops, and we've had it running in pubs, and we've had it running in church small groups. So actually it's really adaptable, and it can run in loads of different contexts. In a way that's going to work for the people in your own community. So you can adapt the course to make it fit for the people who you've got and who are around you in your community.
Yeah, super. I know we've got a few Kintsugi Hope partner churches on tonight, and yeah, I mean, the feedback from the groups that run are just phenomenal, aren't they, in terms of the impact that this has on people's lives who participate in these 12 sessions, whether they're Christians who've been going to church or whether they've come from outside of faith and experienced this church-based mental health and well-being course. The impact is phenomenal in people's lives. So it's been a phenomenon seeing it grow and reach so many people, and just a tremendous tool that we have in our churches to support people. Thanks, Clary. Well, we're going to go on to the final stage of this continuum, which is looking at crisis. We've already mentioned the high rates of suicide in our country. There's an issue of students as well, university students taking their lives. And it's something that we can feel as churches and church leaders very helpless about. But actually, we're going to just take a moment to be encouraged that there are some things we really can do. And so, Stacey, do you want to just share with us the Nightlight Crisis Centres in Lincoln? What are they? How do they come about? And how are they running?
Sure, thank you. Yes, so a few years ago, I think it was 2019, I was part of a health and wellbeing group that had been set up by our local unity movement. So it was made up of people from all different churches in Lincoln. And we were looking at the health and wellbeing needs of Lincoln and what the churches could do to support the health and wellbeing needs. And one thing we identified was that there's a gap in crisis care for people out of hours, people who are experiencing a crisis in their mental health. And that was something that I was really passionate about as someone who had previously been in that position myself. I'd been fortunate enough to have friends and family to reach out to, but it really got us thinking, where do people turn if they don't have that support network around them? And we came across a model in other parts of the country that was crisis cafes, which was a really simple thing, a really simple concept of a safe space that is created for people to come to, where they can talk, they can offload, they can have somebody sit alongside them during that really difficult time so that they know they're not alone. So it's a non-clinical alternative to A&E. And we started to think, how could we get this set up in Lincoln? And we started to have these conversations as a group of Christians. And then it was absolutely incredible. A commissioner from the NHS actually caught wind of these conversations and approached us and said, if we, the NHS, provide the funding, can you, the churches of Lincoln, make this a reality? And that was just absolutely incredible. What a gift from God. So it was a resounding yes from us. We were very excited to be able to do that, to receive the funding and make it a reality. So from 2020, we started. It's great to see some of our volunteers actually on the call tonight. That's really exciting to see some of you who previously volunteered with us. So we opened some cafes in 2020, then had to close again a few weeks later because of the pandemic. But now we're in a position a few years later, and we've actually got 26 cafes across the whole of Lincolnshire. And that's working in partnership with churches and Christian organisations and also secular charities as well. And it's all fully funded by NHS England, which is an incredible opportunity. It's largely run by volunteers. So there are a few paid staff who do the coordination behind the scenes, but we have over 100 volunteers who are all trained in mental health first aid and boundaries, suicide intervention, and we have induction training as well for everybody when they first join the teams. So we have teams of trained volunteers in every location. And as I say, it's a really simple concept. We call it cafe, but that's a very loose term used for drinking a biscuit, really. But what we're providing is a listening ear. We make it really clear that we're not trained counsellors, but we can listen and we can signpost people to other organisations who can help to meet those specific needs that they might be presenting with. And some people tell us the last thing they want to do is talk about their problems. What they really want is to be distracted. So we have craft activities, we have board games, and we just say we can talk about anything. We don't need to talk about your problems. We can just have a laugh. We can have a chat about absolute trivia and nonsense. It's fine. And it's just letting people know that they're not alone, because often people come and they just feel really alone in that dark hour that they're going through, and to know that there's someone by their side just really lifts them. So we've actually taken the word crisis away now, because we found that was creating a barrier. Some people said, oh, I didn't come. I wanted to come, but I didn't come because I wasn't sure that what I was experiencing was a crisis. And because I know there's a lot of people worse off than me. So now it's interesting to hear Clary talk, because now we use the phrase for people who are finding life difficult, because every single one of us finds life difficult at some point. And so what we provide is that early intervention. We have a clinical pathway. If people need clinical intervention, we can pass it on to the crisis team and escalate things. But we're there to provide that early intervention for people who are at risk of experiencing a crisis. So we're there for anyone who's finding life difficult.
That's unbelievable, Stacey. I mean, it is believable because, you know, I've been there, but, you know, it's fantastic that you're collaborating with other churches in Lincoln to deliver this just incredibly valuable service. And I know the NHS there are really appreciative of it and have, you know, expanded the service because it's made such an impact. You want to just mention, you know, the success of it?
Yes, so we've got 8 cafes in Lincoln, but about 15 months ago, the NHS asked us if we would roll it out around the county. So we've been really busy doing that ever since, really. So yes, so we'll have 26 cafes by the autumn.
Yeah.
And so very exciting.
Yeah, and again, just an example of even in crisis situations, the church can take on and be a great support for people in that state, in that situation. So it's encouraging, isn't it, what the church is able to do. So thank you very much, Stacey. I'm sure perhaps we'll have some more questions for you later. I just want to, as we're on crisis support, mention the Zero Suicide Alliance, because it offers some 20 minutes of online training to allow you, anybody, to feel more confident about asking a friend, family member, or a work colleague whether they've got suicidal feelings. The NHS evidence suggests that if we can ask that question, we can reduce suicide rates by up to 80%, which is an astonishing statistic from just simply asking someone if they're feeling, whether they have suicidal feelings. And we've rolled this campaign out over Greater London through churches and seen a really high uptake in people doing the online training. And just as we've seen with the community in Lincoln, the church community in Lincoln, being empowered to help people in mental health crisis. So this is another example of how we can empower people, certainly across our churches, but even beyond that in our community, to feel more confident to ask that question. And actually, if we can reduce suicide by up to 80%, then what a difference that could make in our communities. So I just commend that link to you, and it might be something that you think about using in a coordinated way across your town with other churches. We've sort of shared some activities churches can do to offer support to mental health. It's not exhaustive, but it's a good range that shows you how we can do things across the continuum of need in mental health. But I just want to go on now to mention something about link hubs. And I have a slide here, I think, that I can show you, which is just to share a story from Cambridge, where we have been working with the Metro Mayor, who governs the combined authority.
Sorry, Mark, just to say we're not seeing your slide.
Okay, you are screen sharing. Let's try that again.
We can see your whole screen rather than just one slide, but if that's okay. We see the whole pink movement for recovery book. That's it.
Okay, lovely. So the story I want to tell you about is working with the Mayor of Cambridgeshire and Peterborough, a combined authority made up of 6 local authorities. And he is one of the mayors, one of 5 mayors that we're working with across England, who has been enthusiastic about collaborating with the church to collaborate on some shared missions. And the Mayor of Peterborough and Cambridge is a GP by background and was particularly passionate about mental health. And so this was a project that seemed a good fit for us to collaborate on. And essentially, we brought church leaders from each of these local authorities around the table to meet with the Mayor and to talk about how we could collaborate on mental health. And he was delighted to connect us to the NHS, which is called the Integrated Care System for a county. It includes the NHS, but it also includes the local authorities and their public health departments, as well as voluntary organisations. And we were able to meet with a senior leader in that group who was able to invite us to apply for some funding and also to connect us to key people across each local authority that work in the ICS, whether they're in the primary care services or other parts of the system, to proactively work with churches to help us not only deliver our mental health support in the community, but how we can enhance it, things we can do and people we can contact in the NHS to enhance what we're doing and to refer people to specialist help where it's needed. And to do this, we've needed some funding to do some mapping of what churches do across these 6 local authorities. And we've also needed some funding to actually start bringing church leaders together in each local authority so that they can hear about the strategy and agree to it and ask questions about it, and then hopefully be part of the delivery with other churches, but also connecting to the health and the civic authorities across Cambridgeshire and Peterborough. So we're really excited that we're at the stage where we seem to have a real commitment from the ICS, the Integrated Care System, across that region, along with the Mayor, to deliver this project. And we're excited too that in each of the 6 local authorities, churches weren't in a habit of meeting together regularly to be a gateway for conversations with their health and civic leaders. But now they are beginning to do that. In fact, Cambridge City church leaders had their second church leaders meeting on Tuesday of this week. They're having them every term. And so we're seeing a real progress of church leaders coming together to be an active gateway to deliver services across their local authorities, across their cities. And as I've explained, able to benefit from resources from the civic and health authorities as part of that collaboration. So we are seeing a real opportunity to collaborate. And I just again want to remind you of 4 tiers, 4 levels of which churches can think about collaboration. We have the first lowest level as hyper-local, or sometimes known as the neighborhood, which is usually a church, a medical center, and a school that occupy the smallest kind of local footprint. Then we have citywide, which tends to be a local authority level. And then we have county-wide, which is where metro mayors govern at that kind of level. And the integrated care system, the ICS, operate at that level as well. It's important to connect with the leaders of those ICS systems at that county-wide level. And there is another level as well at national, which Esther engages with, Esther Platt, through Churchworks. But as church leaders, I think those 3 levels that I mentioned, hyperlocal, citywide, and countywide, are important for us to think about. And it's important actually for us to inquire about whether there is an existing network or whether that's something new that we need to develop.